Welcome to the LDS Mental Health Podcast. This is a podcast for faithful women who want healing in their relationships, guidance from God, and internal peace. Each week, you'll hear mental health concepts taught through a spiritual lens from me, a licensed clinical mental health counselor, to help you start thinking in a higher and holier way. All right, I'm so excited to welcome a special guest to today's episode. We're talking about how to know if your child needs therapy or medication. And I'd like to welcome Karen Minotas to the podcast. Welcome, Karen.
Hello, Nikki. Thank you for having me. This is very exciting.
Yes, absolutely. I'd love for you to kind of do a little introduction for people about your background, kind of your education, what you do for a living, and if you'd like to share anything about you and your personal life, that'd be awesome.
Of course. I'm a child and adolescent psychiatrist. I work for the Huntsman Mental Health Institute at the University of Utah, Department of Psychiatry. I also work for Department of Pediatrics, specifically with their school-based mental health efforts. I consider myself a transplant, never
Love it.
leaving.
Yes.
But I've been in Utah since medical school. Medical school was the reason I came here, but I'm originally from Florida. Um, and really just fell in love with Utah. Our people here are amazing. Our training, our medical services are really high quality, and I really love skiing. So
Yeah,
in
great
all,
combination.
it's a great combination. And so I work actually this year is actually my last year that I'll be doing inpatient work in at the hospital for kids who get admitted psychiatrically.
Okay.
And I'll be doing full-time school-based mental health work, which is my passion. I think as being an inpatient doctor, I've just seen how just like limited access to mental health is in the community. And we see so many kids in the hospital that have either never been seen by a mental health provider or have been seen a little bit too late, where their symptoms have already escalated to a point of severity. And
Yeah.
so that's kind of where my passion for school-based health came, and really trying to work upstream with kids, really identifying mental health symptoms before they become moderate or severe, and helping them early on so that we don't have to see them in the hospital or the ERs. And
Yeah.
so, yeah, so that's a little bit about me from a career standpoint.
Yeah.
I also have a wonderful family that I love spending time with. I have a 16-year-old stepdaughter and a 2.5-year-old son who is just, they're the light of my life. And we have a golden retriever who I call my furry son. So
Love it. I love that. That's
yeah,
awesome.
that's a little
Very
bit about
cool.
me.
Very
Thank you
cool. Yeah.
for the
Yeah.
opportunity to be here.
Absolutely. Karen and I know each other because of school-based mental health stuff. So in my day job, I work at UNHS and we work together with school-based mental health. And I wanted to have her on because she's been so amazing just helping me and helping the people that I work with in making our school-based mental health program a success. So she has some great ideas and I wanted to just have her share some of those things. So we'll just jump into some of the questions that I frequently get from parents when it comes to having children in therapy, or even when I recommend that they have their child seen for medications. These are some of the questions I get. So we'll jump through some of those. So first question I have is, what are some of the common signs that a child may be struggling with a mental health issue versus maybe a typical childhood behavior, right? Like, how do you tell the difference, and when should a parent consider seeking professional help when it might be more of a mental health issue?
Yeah, that's a great question, and one that I get really often, right?
Yeah.
Well, is this just normal teenage behavior? Is
Yes.
what I get a lot of, right? Because I think developmentally, you're right. I think teens are going through a big transition in life, and a lot of that comes in trying on different hats, right? Trying to figure out where they fit in their community and their life. And so there's a lot of experimentation that happens during teenage years. And that can be worrisome for parents and for caregivers. But how much of that is normal, right? And how much of that and maybe not wanting to spend time with family as much, more time with friends. And what may seem like isolation is normal for a
Right.
teenager or for a kiddo, right? Versus maybe a warning sign.
Yeah.
So, what I always go back to with families is functioning and consistency in symptoms, right? So, typically, it's far, and I'm not going to isolate it to teenagers, right? Because you also can wonder that with your, I don't know, preteen
Yeah.
or your
Yep.
child.
Elementary age students. Yeah.
So,
Hmm.
right. So, I think what it always goes back to is how consistent are these symptoms? Meaning, like, if you're noticing that they're isolating from you, so spending more time in their room, or if they're um, maybe more irritable or maybe sad, right? We know that these emotions are normal. And so having that range is normal and healthy. However, when you start seeing this consistently for at least 2 weeks,
Yeah.
and a significant change in their baseline, right, of how you know them to be, I think that's something that should raise a flag, not necessarily to say that they have a mood disorder or anything like that, but really it should be a time when I encourage parents to engage in communication, ideally right along the whole way, but really to start asking more pointed, targeted questions of, hey, what's going on? You really seem like, you used to love going to swim meet, and now, you've missed 3 days a week for the last few weeks. Like, what's going on? Is something going on? And just engaging in that conversation to understand what they're going through.
Yeah.
So that consistency piece, right? Are you noticing that they're not sleeping as well? Are you noticing that maybe um their friendships are changing? They're sort of getting into a different crowd at school that maybe is engaging in more high risk behaviors. They're losing maybe other friendships that were valuable to them in the past.
Yeah.
Again, nothing in isolation, but sort of like different changes in functioning and behavior
Yeah.
consistently at least over 2 weeks. So that's where I would say, hey, yeah, something you
This
should
is not
probably start.
typical teenage behavior anymore, or
Right,
yeah.
right.
Okay. I like that.
And then the other piece is functioning. So, that's a big one. Most kids who are struggling with a mood disorder and maybe those symptoms are getting more severe, it's really hard to continue to do well in school, continue to keep up with their extracurriculars, continue to socialize, um, take care of themselves, right? Taking showers every day, making sure they're groomed. Do they look presentable as per their baseline? Every
Yeah.
kid is going to be
Yes.
different,
Yes. Yes. Yeah.
right? But just, the functioning, and what I like to say is, for a kiddo or for a teen, their job is school, right? One way or
Yeah.
another, that's where they spend most of their time. And so that's where we typically tend to see um, deficits in functioning begin, right? Their grades dropping, maybe they're having more absences, more tardies, again, compared to their baseline. And so any deviation from that, plus this consistent, at least 2 week conglomerate of changes in mood or symptoms or behaviors or the way they're interacting,
Yeah.
um, would be the two sort of things coupled that I would say it's time to see someone to do an assessment.
Okay. I like that. So generally just looking at consistency, is this a change from what is typically happening for them? And has this happened for a consistent amount of time? It's not like they were mad that I just said no to this situation and that's where the mood, change was happening. But I'm seeing this consistently every day we're having this irritability, or every day they're sleeping a lot more than they normally would. And that's been happening for over 2 weeks now and can be concerned. So let's say that they they parents are seeing this, they're seeing this consistency, they're having these concerns. Like, are there specific types of therapy that you would recommend for children? And what should parents look for in a therapist to ensure that it is a right fit for their child?
Yeah, so therapy is not made equal.
Yes.
Are created equal
So
is what
true.
they say, right?
Yep, yep, yep.
So we want to make sure that for what is going on for the child or for the adolescent, that they're getting that targeted treatment, right? To really, from a therapeutic standpoint, to really make sure that progress, we're targeting the right thing to make progress.
Yeah.
And and you know, I think it is a really complex, it's a really complex sort of recommendation that
Yeah.
really a clinician would be trained to make.
Yeah.
And so, for example, a lot of kids who struggle with depression may look irritable,
Mhm.
and kids that struggle with anxiety may look irritable. And
Right.
so, really having a clinician, whether it's your son or daughter's therapist, or psychiatrist, or mental health provider of some sort, be able to determine, hey, what's the source of this irritability? As going back to my example,
Yeah.
but it can be, a lot of different things. What
Yeah.
is the source? Where is it coming from? Doing a good in-depth diagnostic clarification
Yeah.
to then be able to have the recommendation made by that clinician of the right type of therapy for that
Yeah.
issue that they're having.
Finding out what the cause is so that we can get the right type of therapy.
Right, right. We do a lot of different types of therapy in kids and teens, ranging from, play therapy that can be really helpful for really young kids who have experienced trauma and maybe don't have the communication skills to really communicate what that was.
Yeah.
So they can sort of reenact it in play, versus, we've also got lots of CBT, which is cognitive behavioral therapy and gold standard for depression, anxiety. Um, and we also have other new treatments that are very effective, like acceptance and commitment therapy, ACT, DBT for kids that are struggling with emotional regulation, it's also called dialectical behavioral therapy. So there's lots of different therapies that we often use in kids and teens. It really just depends on what's going on, and not necessarily even the symptom, but what's the source of the symptom, so that
Yeah.
we can really like target that directly with the right type of therapy.
It's so hard because I feel like a lot of times people will message me and be like, "Do you have any recommendations for a therapist in Draper?" And I'm like, we don't really have like this network where we're like, yeah, I know a therapist here, I know a therapist there. So I always say to people like, you just got to try it out. It's like finding a doctor, right? Like you ask around, you ask people what they recommend. Do you know anybody? You can go to a primary care physician, right? And ask them if they know somebody. I always recommend that people go to Psychology Today and you can
Mhm.
click on like find a therapist and type in all the things you want. Like, what are you wanting that therapist to help with? So I think it's not really like we get this question a lot, but it is kind of hard to answer that in like, well, you kind of need to know what you're dealing with to be able to make a targeted recommendation and just kind of getting started with somebody. Like you can even call your insurance company and say what's covered under our network. That's a great place to start because then you're not paying out of pocket for something. But and then being able to say, this is trauma related, or hey, this is actually ADHD. What would be better would be these kinds of things. But just getting started and getting a diagnosis can also help you point in the right direction, right? With that.
Exactly.
Yeah.
100%. And I love Psychology Today. I use it all the time with my
Yeah.
patients. I think it's a great resource.
Yep.
Um, Sometimes it can be a little bit frustrating because there's a lot of providers on there that maybe have wait lists or aren't taking new
Mhm.
patients. But it's a great place to start working with your insurance company, like you said. And even your pediatrician is a really valuable resource.
They are. Yeah. Yeah. Ask around. It's the best way for sure.
And
So let's
sometimes it takes a
okay.
couple of tries.
Yeah.
I always say to some of my adult patients, or like parents of my youth patients, is it's almost like in a platonic, like clinical way, like dating,
Yes, so
where
very
like
much.
you,
Yeah.
right, like the person might be an excellent provider, an
Yeah.
excellent clinician, but you might just not click. And for
Mhm.
kids especially, you really have to have that connection for it to be
Mhm.
effective. For them to really listen and to engage and open up.
That's really good. I think that leads into our next question that I think we can add on to that is like, how do parents monitor their child's progress in therapy to determine if it's working. And I think there's that piece, and maybe you can elaborate on this, is like, how do you check in with your child to know that they have that relationship with them to kind of monitor that this is happening? Do you have any recommendations of what parents can check in with on their kids to see if this is working or what they should be looking for and supporting their child outside of therapy to make it a success?
Yeah. So right, it's tricky, right? Because I think a lot of parents, and as they should, really want to respect that safe space between the therapist and what's discussed in therapy, because that's where the child has that um, ability to open up in a way that maybe is different from the conversations having had at home. And so we want to respect that privacy and that safe space while also, as a parent, we're like, well, well, how can we help? Like, tell us
Yeah.
what's going on. Are they getting better? Like, and that, um, and so I think finding a therapist that's willing to, not every time, but maybe every couple of weeks, connect with the family for 5 or 10 minutes at the end of a session to say, like, not necessarily it's being talked about, but more so, hey, what are some things that I can work on myself
Yeah.
or work on with my child at home to really reinforce the things that are happening in therapy. I think that is super valuable. And even getting updates of like, hey, are we moving in the right direction? That's an appropriate question to ask. That's not invading privacy. Um, and that the therapist can absolutely share.
Yeah.
And so these types of check-ins are really helpful. And then also checking in with your child. Like I think typically we recommend a minimum of 6 sessions before you start really like assessing, hey, are we moving in the right direction or not? Because it does take time to create rapport and to get some of these interventions um, you know, in line. And
Yeah.
so I would say, if it's been 5 or 6 sessions, like start, and even before that, you can check in with your child and say, hey, like, how did you like
I get it. Yeah.
therapy? And if you're noticing that like, I don't want to go back, like, I don't want to do this after 3 or 4 sessions, I usually say push through at least 3 or 4. Um, then maybe it's not a right fit and trying to understand sort of what are some of the reasons that they're not wanting to go back. Is it just it's hard, which therapy can be really hard?
Yep. Yep. Yep.
Or is it that they just don't connect with that therapist or there's another concern? And so
Yeah.
I think communication from both sides, right, is
Hmm.
really important to get the full picture.
Yeah.
And ideally, you'll start seeing some improvement at home too. There's their willingness to engage again in things they used to like to do, be more social, be less in their room.
Yeah.
Um, Hopefully, families also will start seeing that in practice, maybe um, after enough sessions where they're starting to have progress.
I like that. I think that, it can be hard to tell if the child, like you said, isn't wanting to go because it's getting hard and they're having to do some work. But also I think there's different modalities. Like every therapist does therapy differently. And there's no
Mhm.
like one way. Like we don't go to school and say this is the only way to do it. And they may click with that person personally, but maybe they don't like necessarily the approach that they're doing. They don't want to work
Right.
on those type of skills. So there could be lots of reasons that they don't want to do it, but I think it is a good indicator that if the child does want to go, that's a good sign, right? Like if
Mhm.
they're willing to do that, they want to go, they have a relationship with them, that is great, even if you don't see the progress you want to see. I
Right.
think if they feel connected with that person and they feel like they're encouraging and they're wanting to go, like allow that process to happen the way it needs to happen because they feel connected to that person.
100% agree.
Yeah.
Yes.
So when would you say it's good to maybe consider medication? What are parents looking for that are specific conditions or diagnoses where medication's often recommended over therapy or in addition to therapy?
Great. So it's kind of a two-pronged question, but we'll start with sort of conditions that don't tend to respond to therapy alone.
Yeah.
Um, so with that, we think about, in the spectrum of psychiatric conditions, you have your mood disorders, which include um, depression, bipolar disorder, and then, others that are extensive, but sort of
Yeah.
within that umbrella. And then you have your anxiety disorders, and you have your some thought disorders, is what we call them. So that's where, we call it psychosis, schizophrenia, schizoaffective, or some variation thereof. And then we also have some personality. Um, we don't diagnose personality disorders in kids, but you can start seeing some of those traits develop, right?
Yeah.
And so what we call some personality traits that have developed based on their just lifetime experiences
Yeah.
and perception of their world. So typically, uh, for any psychotic disorder, thought disorder, if actually as a whole, just to not be too gray,
Yeah.
um, those tend to not respond to therapy alone. So if your child is telling you they're hearing voices, they're seeing things that maybe aren't there, they're feeling really paranoid, which is very unusual for them
Yeah.
about their safety. Um, they are maybe talking in a way that's disorganized, not making sense, and they're not under the influence of substances.
Yeah.
And I would definitely consider a sooner rather than later approach to getting them assessed.
Yeah.
That might not necessarily, but it might be indicative of an underlying thought disorder.
Yeah.
Keep in mind that just many hallucinations and perceptual disturbances can be because of many different
Yeah.
things, and it doesn't necessarily mean your child is psychotic or has schizophrenia. So
Want to
please
get
know
that
that.
assessed. Yeah.
Yes,
Just
we want to get
let
it
a professional
assessed.
determine that. Yes.
Yes. And in fact, it's much more common for a child or youth who's having these types of perceptual disturbances to not have schizophrenia and instead it be related to something else that is treatable by something that's not an antipsychotic, right? So we want to make sure that we really understand what's going on, what's the source of it, what's the family history, the genetics, all of that to be able to determine whether this is really a thought disorder. And if it is, that's something that is not easily, it's not treated by therapy.
Yeah.
Um, and sometimes we don't even recommend therapy with the medication in those cases until their thought process is more back to reality.
Yeah. Yeah. That makes sense. Yeah.
The other is bipolar disorder. Again, more rare, right? It tends to develop in people's 20s, most commonly, but we can see it as early as teenagers, especially if there's a family history. That again also does need medications to treat the manic episodes and the depressive episodes. However, this one we often recommend both treatment with therapy for these depressive episodes and for everything that comes with managing bipolar disorder, and then medications as well. That is definitely one that needs medications and therapy.
Yeah.
And then as far as these personality traits that I mentioned earlier, that is one that actually doesn't respond to medication.
Mm.
So we oftentimes, I think that we see a lot of kids that are over medicated because you're trying to sort of chase the symptom, right? When this is something that's psychological, meaning it's less of a neurochemical imbalance and more of just a way that their brain has been wired because of their experiences in their world and in their interpersonal interactions,
Yeah.
sort of some part of kind of their budding personality. And so I highly encourage early intervention for therapy to address that so that it doesn't develop into a full-blown personality disorder in adulthood. But yeah, medications don't
Can help with
don't
that.
help with that, unfortunately.
Yeah.
So those are some of the, definitely need medications. Do not use medications.
Yes.
Worry.
The
And
extreme
then,
ends of those. Yes.
yes. And then the other is, kids that are maybe depressed or anxious or have OCD or have other symptoms have escalated to the point of being so severe that it's impairing their function significantly. At that point, we always recommend a combination of medication and therapy because we know that just therapy alone may not be sufficient to really treat it appropriately at that sort of level
Yeah.
of symptoms. Or if they've been in therapy and they've been attending, engaging, and they're just not getting better, then that's also another time that we consider adding a medication to help with the mood disorder, the anxiety disorder.
I like that. Where do you feel like ADHD fits into this?
ADHD, that's a good one.
Yeah, yeah, because I feel like that could be one of
Yes.
those where you can do medication, you don't have to, but it is super helpful with
Yes. So ADHD is a great example that just didn't come to mind as we were talking, but it actually we've done huge actual like year-long nationwide multi-center studies. I'm sure you're familiar with the MTA study,
yeah.
but it's they took thousands of kids with ADHD and they treated them with stimulant medication, therapy alone to address like executive functioning skills, and then a combination thereof. And the kids who got medications and therapy did just as well as the kids who got medications alone, believe it or not.
Really?
Yep.
Wow. Wow.
Granted, these were preschool kids, so when we were looking at this study.
Yeah.
And then the kids who got therapy alone did not do well. So
Mm.
ADHD is one of those things that we have seen does not um, respond to therapy alone. If you think about ADHD, it's a deficit in the frontal cortex of your brain that's in charge of planning, regulating your emotions, organizing, time management, right? And it has been shown to be a neurochemical imbalance, a deficit in the dopamine transmission. And
Yeah.
so with that, kids can learn all the skills in the world, but if they can't put them in action because of such a high deficit in that neurochemical imbalance, then the skills are really not that helpful. And
Yeah.
so I always encourage both together. Both together is always my preference
Yeah.
to just help. We know how effective our medications for ADHD are,
Mhm.
but then help them learn these skills so that, a lot of times my kids that have been on medications and have been learning these skills, high school and college, they end up not needing it anymore
Yeah.
after they've been, in therapy and with medication for a certain period of time
Yeah.
because they've been able to sort of learn things that ways that work for them.
Yeah.
But it can take, it can take years. And so oftentimes, later in life, people will sort of adapt to ADHD. They're taking jobs that don't involve sitting in front of a
Yeah.
computer for 8 hours or
Yes.
but like I said, with kids, their only job is school. And so if you're having to sit and listen for 8 hours and do your schoolwork, it's really hard. And we want them to succeed and we want
Yeah.
them to have good self-confidence and self-esteem to be able to get to that point in their life.
That's super helpful because I think that's one of the number one pushbacks I get when medication is ADHD because
Mhm.
parents are like, I don't want to put my kid on a stimulant, right? Or like the misconceptions about that stimulant and what that means. And so that's really good to hear that really what you're doing is setting up a good environment for your child's brain to be able to learn what they need to learn.
Yes.
And trying to have them just do the therapy without the medication is like trying to, sending them running up a mountain and putting some boulders in their backpack and saying, get up there faster. Like it's difficult for them to do that.
That's a great way to put it. Exactly.
Yeah.
And they actually in one of these studies, they actually followed these kids into teenage years and adulthood. In fact, one of the biggest concerns I get from parents is, well, I don't want my kiddo to get addicted to stimulants, or I don't want them to
Yeah.
abuse the stimulants or whatnot. And in fact, the kids that were not treated for ADHD early on in life were significantly higher risk and ended up having higher substance use rates in adolescence and in adulthood. And you know,
Yeah.
my suspect is that if you're not doing well and your self-esteem, continues to get hit and hit and hit because you can't do what your peers are doing academically or socially or whatnot.
Mhm.
I mean, you get to a point where either you self-medicate or you kind of get you kind of get involved with the wrong crowds, and
Yes.
it can be really detrimental.
Yeah. Yeah. That's really important to remember sometimes that we're trying to protect them from those things, but sometimes by protecting them from those things and not providing the right resources, we sort of push them into it in that
Yeah.
way. So,
Yeah, unfortunately.
what would you say, let's say a parent has now, they've taken them in, they're on medication. Are there certain things that they should look for or be aware of, like this medication isn't effective, or do I need to go get them reevaluated? Anything specific they need to be looking for once they're on a medication?
Do you mean related to side effects or progress?
I think probably the side effects I'm sure the provider will tell them about, but maybe progress. Yeah. I mean, I guess parents are like, well, what should I be looking for? What do I need to be
Yeah.
like? And I guess part of that is just like, well, if they're getting better, the medication's working. If they're not getting better, it's not working right. But then I guess there are side effects that you probably want to be aware of too.
Yes. So, obviously it depends on the medication,
Yeah.
but the most commonly, are SSRIs, which is your Zoloft, your Prozac, your Lexapro, um, and SNRIs, which are less effective in kids, but that's like your duloxetine, your Effexor.
Mhm.
Um, they tend to take at least 6 weeks. 4 to 6 weeks is what I tell parents for you to start sort of seeing, for you and for your child to start noticing any benefit.
Yeah.
That's why, I always say, you know, if you're going to make a med change, we need to at least have 4 weeks under our belt to really assess for any even preliminary improvements. I do think there's also a little bit of a placebo effect when it comes to not just kids, especially kids, but not just kids, but adults too, right? If you're taking something to try to help yourself, that's sort of a self-care in and of itself,
Yeah.
right?
Yeah.
And so I think there is a little bit of a placebo effect that a lot of kids start feeling a little bit better even before that.
Yeah.
But from a pharmacologic standpoint, the way that the medication work, it does need to be taken every day consistently for at least 4 to 6 weeks. If around that time, where it's been 4 or 5 weeks, you haven't noticed any benefit, or if things are getting worse and there isn't a new stressor, there isn't like anything environmentally
Yeah.
new that could be maybe just making the depression worse in and of itself, then I would say it's probably time to consider a different medication with your provider. If you've seen a little bit of improvement, and typically parents tend to see it before the child says they're feeling better, because you're some of those energy and motivation tends to improve before they start feeling their emotions improve.
Yeah.
And so families tend to see them just being more social, out of their room a little bit more. And those are like signs that, hey, I think we're getting a little bit of progress.
Yeah.
Um, but even if there's a little bit of that by 4 weeks, I always say, hey, we can bump the dose a little bit, um, or increase the dose a little
Yeah.
bit and continue to watch it. We know that if it's starting to see some improvement at 4 weeks, the benefit actually continues to increase up to 12 weeks. And then that's where it kind of peaks and plateaus.
Okay.
But, we don't have the luxury of waiting 12 weeks when
Yeah.
your child
Right.
is struggling.
Yes, exactly. Exactly. Yeah.
And so definitely not going to max dose, but really going to a more like, I think we oftentimes start at, to be conservative, a low dose. We give it 4 weeks. If we're seeing some improvement, then we say, okay, let's actually get it to what we would call a moderate dose.
Yeah.
And then really they're just waiting and continuing, making sure that we're also combining that with therapy.
Yeah. Yeah.
But yeah, those are some of the signs I would say is the families really do notice mm, before the child. And those are some of the signs that it might be helping.
Yeah.
And that would be sort of some of the next steps from there.
I like that. I like that. So if a parent's listening to this and they're like, okay, I want to get my child into therapy or maybe talk to them about medications, or maybe they've tried talking to their child and their child's resistant to the idea. Do you have any suggestions for parents kind of having this conversation with their kids about therapy or medication?
Yeah, it's really hard. I think that a lot of kids, from what, my experience with them, tend to say, well, I don't like feeling like I'm the problem,
Yeah.
right? Like my parents say, something's wrong with you. That's what a lot of kids will hear if parents offer to help them.
Yeah.
And I hear a lot of, I don't want to be fixed. I don't need to be fixed,
Yeah.
is
Yeah.
a lot of what I hear from
Yes.
kids and teens. And so I think the most effective way to communicate with your child, I think just having that climate at home, just even before they're struggling,
Yeah.
just of always just like open line of communication both ways.
Yeah.
Obviously, we don't need as adults to divulge things that are maybe inappropriate for their age or and development, right? But like just being vulnerable with them and relating to them, and then allowing for that safe space for them to tell you things without getting in trouble necessarily, within reason, right?
Yes. Yes.
But
Yes.
really for them to feel like, hey, no matter what, I know I can come home and talk about my day regardless of what happened. And just creating that climate at home is super, super important, that open line of communication.
I like that.
And then when they're struggling and you've noticed, hey, something's off, like I think, we need to go in and get assessed. If your child is resistant, really understanding their perspective of why they would be resistant. Like, is it something that you're nervous about? Like,
Yeah.
we can sort of talk together and troubleshoot that. Like, are you scared people are going to know that you're going to therapy? Like,
What is
I
the
always tell,
resistance to it?
yeah, what is the resistance? Like, what
Yeah.
is going on? And I also encourage families to be open about, if there has been someone in the family that has had to get therapy or treatment for mental health, like talk about it,
Yeah.
reduce some of that stigma, and that maybe the child or the adolescent is worried about what the family is going to think about them, what you're going to think about them, and really just making it more of like, hey, this is a medical condition, just like diabetes or when you break your leg, right? Like we all need to get help. And some of us have been there and this is what it's looked like. I think
Yeah.
that can be really helpful.
I like that. Breaking down that stigma can help people feel more confident and comfortable reaching out for their own support and help too.
Yeah.
I like that. Well, this has been awesome. I love this wealth of knowledge. I feel like this is going to empower parents to feel like, okay, this is something I have more knowledge about and I can approach with my kids and access those resources that can be really helpful for them. So thank you for taking your time and sharing your wealth of knowledge with us.
Absolutely. I'm so glad that we could connect and that hopefully I could just impart a little bit of knowledge on parents that are out there in the community. So thank you.
Yeah, thank you. Thank you for listening to the LDS Mental Health Podcast. I hope you were able to find ways of healing, guidance, and peace. If you liked this episode, please share it with a friend who would love to start thinking in a higher and holier way as well. Or hit that follow button so you don't miss out on any episodes. Also, check out the links in my show notes for other episodes you might like and links for other mental health resources on my website.